हेलो एंड वेलकम टू आरोग्य फिजियोटिप्स। आरोग्य फिजियोटिप्स में आपका बहुत बहुत स्वागत है। आई एम डॉक्टर दिलप्रीत एंड दिस वीडियो इज गोइंग टू बी फेज 3 exercises following a total knee replacement surgery. I hope you're watching this video after you have already gone through phase 1 and phase 2. Those two videos are also on our channel. This is a continuation of the series. Make sure you have gone through the first and second, done all these exercises, and now you're trying to do the phase 3 exercises. So we will start with the balance exercise first. So you can start to try and balance on one knee now. So all you have to do is bend the knee of your unoperated leg and try and balance for as many seconds as possible. Okay, and then once this feels very comfortable, you can progress to try and close your eyes when you balance on this knee. Make sure you have some support to hold on to if in case you feel disbalanced. If you've been operated on both legs, do this exercise on both sides. This exercise is for strengthening your hip flexors so that it is better, your ambulation and walking style gets better and you don't have a limp. So you can take support with your hands, keep your upper body absolutely straight. Use a yoga block, a water bottle or any other object, place it next to your foot. All you have to do is, while keeping your back straight, lift your leg up and go over the object. Okay, make sure you're not slouching, make sure you're not tilting backwards at your back. Your back remains straight. All you have to do is lift and go to the other side, lift and go to the other side. Start with around 8 to 10 on one leg and then increase the intensity once this feels comfortable. Next exercise is side walking, similar to phase 2 exercise. But now you will put a loop band or resistance band around your shin bones and you will try and take longer steps that will increase the resistance and the stress in the band. Longer step, close. Long step, close. This will help in strengthening your abductor muscles or the muscles on this side of your thighs. Again, you can take 5 rounds to the right and then 5 rounds to the left. The next exercise is spot march, but with a resistance band. You will loop it around your foot, hold on to a support next to you. You will just march at the same spot. Okay. Once you're doing this, you're creating resistance in the band. You will feel a lot of pressure here in your hip flexors. Try to do at least 10 on one side and then you can switch sides. Next exercise is a forward lunge. Again, you will hold on to the back of the chair, one foot in front, one behind you, and you will bend your knees, both the back and the front knees, as much as you can. Feel comfortable doing. Try and hold for around 5 seconds and then slowly back up. Do 5 repetitions with your left leg forward. Do 5 repetitions with your right leg forward. Next exercise is wall squats, just like phase 2. Your feet are away from the wall, some distance between them, hands in front of you, back against the wall. But now you can go easily up to 90 degrees. And you will try and hold this position for 3 to 5 seconds and then push yourself up. You can go to around 90 degrees, hold for as many seconds you feel comfortable, and then come back up. Try to do at least 10 repetitions. The next exercise is called step downs. So make sure you're taking the support of the railing, not holding on tight and putting your body weight on it, but just so that you don't lose balance. All you have to do is bring your leg forward, try to step down. But don't really put your foot down completely. You are just going down, touch and come back. Go down, touch and come back. You will feel a lot of load on the knee of the opposite side. Just touch and back up. You will repeat the same thing on the opposite side. Just go, touch and come back up. Try 10 on each. The next exercise is lateral step up. So we've already done stair climbing, standing straight. Now we will do it on your side. So again, put all your weight on the left leg and come up and come up. Same way. Slowly bend the knee, come down and come down. Once you're done with 2-3 rounds of this, you will turn around and now the other leg will go up first. 2 steps up and then slowly 2 steps down. At this stage, you can start with static cycling if you have one at home or at the gym. You can aim at doing 10 to 20 minutes of slow static cycling. You can also start with some form of aerobic or endurance training like walking. Initially start with 20 minutes, progress up to 30 to 40 minutes at a slower pace, and then increase your speed. This concludes phase 3 rehab of total knee replacement. Please go through all the videos and follow them one after the other. Make sure that you do the first 3 months of your rehab under the supervision of a physiotherapist, because everyone's progress looks a little different. Post 3 months, you can continue these exercises at home. Please like, share and subscribe to our channel. In the comments, you can tell us how your progress is going, or if you have any questions regarding the exercises. Please let us know if there are any other topics you want us to cover in our videos, and witness your fitness with us.